here with Rachel again. We are going to be continuing to talk to her about her story with her daughter Ellie, who has PRS, and their experience with mandible distraction or jaw distraction. So stay tuned.
And
so for people who don't know, can you talk more about how the surgery went and why you have to come back in 8 weeks?
So if you choose mandible distraction, what they're going to do, the first thing is they cut the baby. It's a 1-inch incision on both sides of her neck. Your surgeon would put it right where the wrinkles are. So the good news is the scarring, although we were told it's going to be 4 inches long when the baby's an adult, but it's so fine you don't notice.
Okay.
And really, Ellie is 2 years old now, and we don't notice.
Awesome.
You have to be holding her and having her look up to go, oh, I see them.
Yeah.
So you have to be very close.
Okay.
So that was the first incision, and they attach what's kind of like brackets maybe onto the jaw. So they saw the jaw off of the bone, and then they attach these brackets, and then there's going to be handles that are going to come out right at the tip of the chin, and it's right underneath.
So it starts here and the hardware goes all the way to here?
Right.
Okay.
And so there are these arms that are going to come out, and what they'll do is they have a special screwdriver that they're going to use. And you can't turn it backwards, which is good. It has an automatic protection. It turns it, I believe, 1 millimeter at a time, I think. And it's really easy to use, but your surgeon knows how to use it, and the primary, the physician's assistant also knows how to use it. So half of Ellie's cranks were from a physician's assistant. Okay. But what they do is, for Ellie, they cranked it, I believe, 1 millimeter in the morning and 1 millimeter at night, and this was every day while she was in the operating room. Okay. The first adjustment was in the operating room, and then it was
every day in the hospital.
Every day after, yes.
And how long were you in the hospital?
Well, this was a total of 3 weeks in the hospital. So for 1 week we were observing, and then that following Friday we decided to do mandible distraction. And then that Monday we got the results of the sleep study, which was a failure.
So and you're like, I'm doing this.
Yes. Yeah. So we had that confirmation. And then Tuesday was her surgery. She was intubated, and I'm glad we got the warning because that was hard to see, the intubation and the, no, you can't hold them, like they lay here.
So that was similar to the tongue lip adhesion.
Yes.
Because Ava was out and sedated for 6 days with the TLA. And we couldn't touch her for that amount of time. How long is it for the jaw distraction? I
believe they said 3 to 5 days or 3 to 6 days. Tongue lip adhesion was longer.
Yeah.
The one thing that was difficult for us was we were told this is your opportunity to go home and clean your house. Baby's just sleeping. Go rest. Do whatever you want. Yeah. Ellie did not sleep through it. She was semi-awake the whole time, and she was fighting the intubation. Yeah. So the doctor, the primary doctor, we were going to hold off and keep her over the weekend intubated. That's what they wanted to do. Yeah. So I believe it was like 6 a.m. on Saturday.
Yeah.
Ellie extubated herself.
Oh,
and
that's
luckily,
so scary.
It is, but luckily the primary surgeon, the primary pediatrician who was on the floor had been present in extubation, so he knew what to do, so he just finished it. Yeah. And so then we walk in at like 8 in the morning, and there is our primary surgeon who did this, and she goes, ta-da! And there's Ellie with no devices or anything.
Goodness. You know what's funny is that, like, and obviously this is so different in severity, but like they had wanted to keep Ava's little button under her chin for longer, and she took that out herself too. Like, I think they're just sassy. I think they're like, enough of this.
Yeah. They're NICU survivors. They have grit.
Which is amazing. Well, but I mean, I'm glad that everything was in alignment so that it was less of a scary than it sounds.
It worked out perfect. And I was so happy to see her extubated because she was miserable and she was cranky and she just wanted to be awake and she was fighting it. Yeah. And they even said she was, the words we heard from most of the NICU's nurses is she has moxie. She's a firecracker and feisty. We heard that all day long.
Is that true as a 2-year-old also?
Oh, yeah. Oh, yeah. She's potty training herself currently.
Oh, my God. course she is. She's ready, so she's gonna do it.
Yeah. Okay. When I want a break, she just tells me I'll try to put a diaper on her, and she goes, "No, Mama." And she goes and gets her big girl panties.
That's amazing.
So she only allows diapers now at bedtime and nap time.
Oh my goodness.
Other than that, it's a no, Mama.
Hilarious and amazing.
So yeah, she's potty training herself. So she definitely has moxie and sass. So
she takes it out, and you show up, and they're like, "Here you go." But I do want to backtrack a little bit to
backtrack to the ENT as well.
Okay.
When we
do you want to do that first?
That works.
Okay.
Yes.
Okay.
So how we ended up having additional confirmation into doing the surgery was our ENT was able to look at her and her airways and her tongue, and he's been doing it for a while. And we told him, and I don't know if this will help in your situation, but we said, honestly, what would you do if this was your daughter? And he goes, all right, can I speak candidly? I'm like, yes, please.
Yes, please.
And he goes, that chin is back really far, guys. We really, really definitely want to do something about that. And there's a 20% chance of tongue lip adhesion not working. And he goes, she looks like the cases I see that fall into that 20%. Okay. So I'm just telling you, if this was my daughter, I would do mandible distraction. I don't like how far that chin is.
So that was just from a face visual. It wasn't from a camera or
right.
anything.
No,
okay.
That was just him looking at her, and he pulled her little tongue, which was curled backwards. He pulled her tongue forward. And he's just looking in there at how her jaw was.
That's amazing, because I had assumed, obviously incorrectly, that it was similar to our case where when Ava was under anesthesia, they put a camera down, and that's when they came and confirmed, like, we think TLA will work. Okay. I thought it was another case where it was under anesthesia. It was just a straight visual. That was just
straight visual of him looking at her in her little NICU bassinet.
Okay.
And
so
going with his gut.
For people like who are following along and interested, the things that I have found interesting so far is the visual of the chin, like that the ENT was like, no, we probably need a mandible distraction.
And it was from looking at the inside of the mouth too. Okay. I don't know what that difference was, but he saw something.
A visual difference. The difference is in car seat. So if you fail the car seat test, it sounds like that's just an indicator that there is something more severe going on. Not necessarily that you can't do TLA, but just it's so far in the other bucket. Ellie failed the car seat. She didn't even get to the car seat test.
Yes, so her oxygen levels dipped automatically if she was on her back at all. So at that point, they're like, we're not doing a car seat test. We're not willing to. She's just going to fail it. So she has to be lie down. So we didn't do the car seat test until we were ready to leave. Okay. And that was 2 hours before we left the hospital. 3 weeks later that we did the car seat test.
There's such a spectrum. So what my understanding is that there's usually 5 options for treatment for PRS. You've got just positioning, so it's not surgical. You just have to have gravity help their tongue stay down. And then there's the tongue lip adhesion, which is what Ava has, where they sew the tongue to the inside of the lower lip that pulls the tongue forward so that the gravity isn't working against them and it clears the airway. Next is the mandible distraction or jaw distraction, and then after somewhere in that range, I also have heard of a nasal trumpet, but for whatever reason, and I don't actually know why, I can only speculate, I haven't heard it used as often in the States. I know that in the UK they use the nasal trumpet a lot, and what that is it's a plastic piece where they put it down the nose and it goes back towards the airway, holds that tongue down, and then you tape the outside pieces to the face to keep it in place, and that just holds the tongue down. Now I have no idea if that is enough for patients that have been getting jaw distractions in the States, because I don't know why they do or don't use it here.
I remember our surgeon told us why.
Okay.
But I don't remember what she said.
Okay.
She was one of those moments, it was so quick because we had heard about the options in the States that I put it in the back of my brain. Right. So far back, it's gone.
Right. Well, and that's okay. There's a lot of information in those meetings that's overwhelming.
But there was a reason why.
Okay.
I don't know what it is. But
so we'll have to, if anyone knows and wants to comment below, I just know that I don't know anything for sure, and anything I would say is a guess, so I don't want to give bad information. Yeah. And then the most severe cases do need tracheotomies because there's just, in the immediate, the baby is struggling so much that they need air, and that's the option. So it's been really fascinating to see, like, which cases go where and why, and I'll try to come back to that at the end, but I do want to hear more about what happened when you went home after the mandible distraction. How far forward did they bring it? What was the swelling like? Because we're only halfway through the story, and I want to make sure I get the rest too.
So Ellie's chin was actually cranked forward 1/2 inch.
Okay.
In a span of, I believe it was 6 or 7 days.
Okay.
That her chin was cranked forward, so 2 millimeters a day. When in the operating room, when they cranked her jaw forward, they did 1 millimeter to start. Her tongue immediately cleared the palate plane and went forward.
That's
her
amazing.
Tongue would have been forward. I know, if her jaw was just 1 millimeter forward more, I was like, how different of a situation would we have had if it was just 1 millimeter forward?
That's crazy.
Or what's even more scary, would we have brought her home? So I'm also going, you know what, in some ways I'm grateful that it happened because it tied our hands and we might have thought everything was okay. And then the worst could have happened. So but it is crazy to think 1 millimeter was the difference of a tongue being forward or backward. So her jaw was cranked forward a total of 1/2 inch approximately. It's in millimeters. I don't remember the exact millimeters, but it basically was 1/2 inch. At that point, feedings instantly got better. It went from, and we have the nurses trying to feed her. And the best we could get before surgery was maybe 1/2 a bottle. I remember actually the night before surgery, one nurse got her to eat a whole bottle. One time, we were so happy. We're like, oh no, should we not be doing surgery?
Right, like, oh wait, she's fine.
Yes, exactly. But then she went right back to the same pattern. And so we did the surgery. She comes out of surgery, and it was that much better. Of course, we did have to wait. She was intubated. And I think they waited a little bit. I don't remember how long. But once the feedings did begin, they got better and better. We were sent home. We were told there's a high likelihood that we'll be coming back because she was still not eating 100% yet. And they were still doing the NG portion. One of the differences that did help us is it's not that every 3 hours feeding, and after 30 minutes, we're putting it through the NG tube, period. Which is what we had in the hospital. So if she's hungry an hour later, we're like, okay, have some more. So Ellie did a combination of milk and formula, and she had a dairy allergy. So she was on Nutramigen, which actually really helped. So then she didn't have the congestion because Pierrot babies are so prone to being affected more.
Phlegmy,
Yes, and both of her sisters had that dairy allergy, so I checked that immediately. As soon as she was born, we figured that out instantly. It took 1 bottle to go, never give her this again. Yeah, and we went straight to Nutramigen like sisters. So we got her home. My husband could feed her. And I was more of the like, no, I'm gonna feed you in motion with your swallows. So my husband would sit there with the most determined face, and as soon as she would go to swallow, he's squeeze, 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 and I'm sitting here, squeeze. So I didn't get more than half a bottle. We started off with Haberman, and I wish they would have brought us back to Dr. Brown. So when we went to meet with our feeding therapist for the first time, she goes, and why haven't they tried Dr. Brown? And I'm like, I don't know. And I had forgotten that they did try that once, but this was when she first came in the hospital. But she was choking on it. And they didn't want to try it again. So our feeding therapist goes in the back, brings us that bottle, because we were already nervous that we're going to end up back in the hospital, because we're like, oh, she's difficult to feed. Instantly, she goes, okay, try a feed. She had the whole bottle.
I love those bottles.
And it was a normal baby after that. I mean, we use the phrase loosely, but it was a normal baby. Once we were able to add that adapter, and it changed it, and she's eating normal, and all of a sudden she's gaining weight now.
Now, I think you had shown me some pictures with some red around the turn site.
Yes, they call that healing pink.
It makes me nervous.
I was terrified because it looked like infection. So every time I went in for a doctor checkup with everyone, I'm like, is this okay? Is this okay? Even though I knew it's fine.
But there's like there's no like pus or anything. It's just pink.
You look for pus, you look for heat. So I can tell you every hour I was sterilized the hands, check temperature.
Are you okay?
Yes, and there's Bactine that we had to use, and we might have had to do something else as well, and I don't remember what that is offhand. But that does feel intimidating at first.
Yeah.
And you have to keep gauze over it. You're not supposed to leave the house, and if you do, everything has to be covered because it is metal going down to bone.
So you left when she was about 3 weeks old, and you went back when she was 8 weeks old. So that was 5 weeks?
I think she was actually 9 weeks.
Okay.
Yes.
What about 5-6 weeks of just not minimizing going out and
we didn't go anywhere.
Okay.
Yeah, we
and
didn't go
keeping
anywhere.
it like real clean, but like okay.
Yep, we didn't have people over at the house. I did have school-age children, so we had to go into what I called for the kids sick protocol. Okay. What it meant is you're full of germs. You go to school. As soon as you come through that door, your backpack stays here in the front room. I'm going to spray it. You go upstairs and shower. You put your clothes immediately in the washing machine, and their clothes got washed on hot every single day.
That's kind of genius, actually.
Yeah, and I kept the clothes, or I kept them on. They were on vitamins. Yeah. And so we ended up making it through the whole year really not being sick. Amazing. And when little colds would come in because I was pumping, Ellie never got sick. Awesome. And as soon as I stopped pumping at 11 months, she got her first cold.
Yeah.
2 weeks later, she got a cold. And I'm like, okay, this is okay now. Even though I was still terrified because like, you're not supposed to be sick. Wait, now it's okay.
So what was the surgery like to remove the hardware, and what was it like to see her for the first time without the hardware?
Great question. So when we had the hardware removed, I did not expect it to be another 3-hour surgery. That actually really surprised me. I thought, wait, we're just taking it out. Like, why not an hour?
Just pull it out.
So yes, as the bone calcifies, because they do 1 millimeter at a time, because bone is immediately starting to form behind it, and then it calcifies and becomes real bone. Okay. That's why it's on there for 8-9 weeks. Yeah. So the bone can harden and be real bone.
Cool.
Very cool. When it came out, the hardware adheres to the bone. Yeah. So they actually have to saw it off and chisel it off. Okay. Plus the 3-hour surgery. But it was like nothing. Oh my goodness. When she got out, I mean, you see the stitches are reopened again. Okay. So you have that. And then other than that, I don't think she even stitched here because that was left to drain. Okay. So these holes were unstitched and everything drained, I believe. I hope I'm getting that right. Okay. So we followed the same protocol as before. She had special Band-Aids that we put on them for the first few days, and then Bactine, and then we went and we followed up once I think it was about 5 or 6 weeks later. Okay. And by that point, everything is not only pretty much, I think the scabs all fell off by that point, or they were about to. Yeah. They might have pulled the last scab off in office. Yeah. And then we began what they called, we went from wound care to scar care. Okay. And so she has, it's like almost like a Vaseline gauze that we would put on there. And what it would do is just help to soften the skin, and then I would have to massage it. And then I'd massage along here. And Ellie did not like that, so I tried to.
Didn't.
No.
Oh, I was hoping it was like relaxing.
No, she doesn't. No. She still doesn't like anyone to touch her face.
I mean,
she
it makes
freaks
sense.
out. And if somebody does this to her, because remember how they have to search for IVs, Ellie was always pulling out her IVs, always. So the second someone grabs her hand like this, you might as well think someone's ripping an arm off.
Yeah, she's like, no.
This she remembers.
Yeah.
So between that, do not touch her face. So I would do that while she was eating. That was the best way for me to do it. And what that does is it breaks down that hardening, I think it's tissue, which forms those hard scars. Mm-hmm. So then it keeps it nice and soft. Okay. And when it's soft, then you have just less bumps and scarring.
We had to do something similar for Mabel's lip and tongue tie. Okay. Where we were doing like a lot of massaging and tongue exercises and stuff. Okay. So it's just one of those things that I didn't need to think about of the differences, because the TLA, like once she left the hospital, that was kind of it.
Exactly.
We didn't have to, because all of the stitches and stuff was on the inside. Yeah. So we didn't have to do anything.
No. And she's intubated for a week, so they've healed enough that they're not going to rip back open.
And honestly, when we removed the TLA, she was eating within like 24 hours. And I know it's not the same with like every kid, but like our plastic surgeon was like, yeah, this is the easiest surgery you're going to do. And I was like, okay. It was the one I was most freaked out about because I had the most build-up time to think about it. And then I was like, flashbacking or something about like the first one, and I was like, I got real nervous about that one, and it was the easiest one. So
yeah.
But anyway,
I thought the palate surgery was the hardest one to go through for myself.
For different reasons. I thought it was harder seeing her in more visible pain, but the not being able to touch her for 6 days, because I like active care. So if I could hold her and comfort her actively after the palate repair, I felt like I could do that. When I couldn't touch her or really do anything other than just be in the room, that for me personally was harder.
Okay.
But they were both hard just for different reasons. Like for her, I think the palate repair was probably harder.
Yeah, that was harder for us because we saw her crying and you could see the pain, and it's you're not intubated. You know the pain's there. You can't sleep through it. So all we did was hold her. And it was a lot like having a newborn again for the first like 3 weeks.
Yeah.
Because all of a sudden we're doing round the clock care. She needs round the clock comforting. But then after we hit several weeks later, she was good to go.
She was like fine.
Oh, she was totally fine. And then when her no-nos came off, I mean, it was like slapping everything she could. It was freedom.
Okay. So let's see. Is there anything else you want to share about the mandible distraction? Because I feel like, one, I get along with you really well, and we can talk about this for a really long time, so I want to make sure that we are concise. We end this with a couple of questions that we had from the group, and then try to, at least for this video, cut it down. Is there anything else you wanted to share about the mandible distraction experience?
Yes. One quick tip we found that worked out really well is the Halo swaddle sack, I believe is what it's called. The hospital put her in that because she could not be swaddled, which is not a surprise. None of my kids will keep us swaddled. Doesn't matter how tight you make it. And then when you have that Velcro, they couldn't get out of it. But they also sleep. But for anyone who especially chooses mandible distraction, where now you have that hardware and you have just extra irritants, because your littles can grab that hardware and tug on it. Of course, it's adhered to the bone. It's not coming off, but it's going to hurt them. It's going to make the skin bleed a little bit. That did happen from time to time. But when they're sleeping and they're little and they can't roll over yet, and you can use that swaddle sleep sack, it is wonderful, because now they can't grab at that hardware, and all of a sudden they're waking up crying, and you come in and there's some blood dripping down their face. It eliminates that issue.
Okay. That's cool. Awesome. Okay, so we have so much more to share on this story, but because this video is getting really long, we're going to cut it and then continue it later. So stay tuned. Another one is coming soon. Bye! Say hi, Ellie. Here you go. Yay! Mabel's here too. Oh, Mabel!